Here are just a couple of nursing hacks that every single nurse should know. What's up, you guys, and welcome back to my channel. For those of you who are already part of the family, for those of you who are new, welcome. My name is Kiara Selena, and this is my channel, Nursing with Key, where I mainly make nursing-related videos, but also do a bit of beauty and hair. So if you're into those things, feel free to join the family by hitting that subscribe button and turning on your notification bell to not miss another video from me again. Now, very quickly, before we start, I just wanted to share, for those of you who did not see in my community section, I am selling my NCLEX study guide. This is the study guide that I use to study for NCLEX. It is very similar to the NCLEX exam, at least where I'm from. Obviously, there's slight differences between Canada and America when it comes to scope of practice, but when it comes to all the other case study questions, everything should be the same no matter where you come from. I'm not saying that you should solely use this to study for NCLEX. You should definitely use UWorld and all the other stuff that people use to study for NCLEX, but this is just a really good additional study guide that you can use to get you prepared for NCLEX. So if you are interested in that, I am selling my study guide. There's over 200 pages with information on there to help you prepare for your NCLEX exam. I'm selling it for $10. You can PayPal me the money. You can just send me a DM with a picture of the proof that you sent me the money on PayPal. I will leave my email down below, and I will send you guys the email document right away. All right, so as mentioned, I'm just going to be sharing a couple nursing hacks that I think every single nurse should know, and I don't want to make this video too long, so let's get into it. So the very first trick I want to talk about is a trick that is quite popular, but some of you guys may not already know this, so some of you guys will be learning something here today. But this is for people who have veins that are difficult to find. Sometimes, some people are like me. It is extremely hard to find veins on me, and whenever I have to get any type of blood draw and nurses have difficulty finding my veins, one trick that I have them do is apply warm compress. So you can just take a washcloth, put it under some very warm water, apply it to the area where you want the vein to pop up. If you hit the vein, you put your tourniquet on and nothing worked, then you can use this as a last resort. Kind of just put the warm compress on the area where you want the vein to pop up, and obviously heat will cause dilation and it will cause that vein to bounce right up, and it'll be a lot easier for you to do your blood draws. So if you have difficulty with blood draws or phlebotomy, definitely try the warm compress trick. Now the next trick is a little bit creepy. It's a little bit creepy if the patient wakes up, but one thing that our teachers, or two of my teachers actually had us do, especially on my med-surg clinical where we started extremely early, I was on the floor at around 7:15, and on the med-surg unit, the very first thing I would do is, after report, is take my patient's vital signs. And like I said, it's very early. I started very early in the morning, so a lot of times most of my patients were sleeping, and what I would do is I would take their respirations while they're sleeping, but kind of just standing out the room. So I would avoid trying to wake them up so I could really get the respiration rate while they were sleeping. Another thing you could do, that could be a little bit creepy if they wake up and kind of just see you staring at them, but you could just explain to them that you were taking their respirations. But if they are up, another thing you can do is kind of pretend that you're taking their pulse and take their respirations while they don't know, because a lot of the times when you tell someone that you're going to count their respirations, they will kind of alter the way they breathe, or they'll really try to control their breathing, and then you won't really get an accurate reading. So if you want an accurate reading, the best way to do it is to distract your patient, make them think you're doing one thing when you're actually taking their rest, or take their respirations while they're sleeping. The next one is really good, especially if you work in long-term care, because in long-term care, a lot of patients usually have pressure ulcers. You see pressure ulcers a lot in long-term care. And one thing that nurses apply for pressure ulcers is usually Owl's paste or Triad. And if you guys haven't seen it, it is extremely thick. Like, it's extremely thick, and when it dries, it's a very thick, chalky type of consistency, and it can be really hard to remove. But if you have any Vaseline, or if you can find any oil, even like baby oil on hand, any type of oil, and you rub that on the Owl's paste, it'll literally make the Owl's paste slip right off. Another thing that is easier to find in the hospital is mineral oil. I've seen a lot of mineral oil in the hospital. So any type of oil, baby oil, mineral oil, or Vaseline, if you use any of those, apply it to the area and wipe that off with a nice warm cloth. It should slip right off. This one is kind of nasty, but let's not even act like we don't know that nursing staff be just nasty out here. Sometimes they leave patients in their BMs all day, or they clean the patient and they don't clean the patient properly. And sometimes you take your patient's brief off and you literally see bowel movement crumbs stuck onto their hairs, onto their pubes, on their butt hairs. Like, let's be real. Come on. We know what's up. So if you want to take that off, one trick to take it off is using shaving cream. A lot of, I don't really see, I don't really see that on women a lot, but I do see it more on men because men are obviously hairier. And a lot of times men, especially if you work in a residence, they will have shaving cream in their rooms because they are getting like, a shave every week when they get their bath, or, every other day, or, however many times a week. So you can just take a little bit of shaving cream and put the shaving cream on there and wipe it off with a warm towel, and it should come right off. And if you are in a female's room and she does not have shaving cream, you can use lotion. Lotion also works, but in my experience, the shaving cream works really well, much better than the lotion, but the lotion is also effective. The next one is for foul smells. Foul smells. You smell a lot of weird things in the hospital, but like sometimes things are unbearable. Have you ever smelt like a bowel movement from a C. diff patient? Child, that thing hit different. It hits different. But if you guys want to avoid the foul smells, or you guys are going into a room that has a very, very foul smell, you can either use peppermint oil, which people don't usually have on them, but if you have it, you can use either peppermint oil, if you can find Vicks anywhere around, or even toothpaste. What you can do is take the toothpaste, apply it to one mask, put the mask on, and put another one on top of it. Right? So that you're not going into the patient's room and they're going to see like a line of toothpaste under your nose. Cause then, it can make them feel a little bit uncomfortable, kind of make them feel some type of way. So if you want to be slick with it, take a mask, put the mask on, smear some toothpaste right where the nose area is, and then cover it with another mask so that the patient doesn't see the toothpaste that you have on your nose. And, just that minty smell can kind of help with, whatever's going on in there. And the last thing is for mainly for people who are working in residences. If you have a confused patient, a patient who suffers from some form of dementia, a lot of the times they can kind of pace behind you, follow you, or sometimes they try to fight other people. And in order to kind of get them to calm down, the easiest thing for you to do is just obviously find a distraction for them. And one thing that works really, really well is just having them do a task. So, for example, I have a patient at the residence that I work at, and she's like always super confused. And whenever it's like supper time or something, I have her pass out the cups, or sometimes I bring her to the laundry room and I just have her fold some towels, just do pretty much any task. You can have them color, you can have them draw, you can have them write, you can have them read. Any type of distraction. But one thing that works really, really well in my experience is having them fold stuff. For some reason, when you give them a bunch of towels to fold, they will literally sit there for hours folding towels. I don't know why, but that trick just works really, really well. And another thing, if your patient is confused, or if you're working the night shift, the same patient I was talking about, when I work night shifts, she has like insomnia like crazy. Well, I wouldn't really say insomnia, but she's always up. She doesn't sleep for long. And a lot of the times it's either that she's wet, that her brief is wet, or that she's hungry or she's thirsty. So I usually just ask her, and if she can't answer, I'll just give her a cup of juice or give her a sandwich or a cookie or something, or I take her to the bathroom, and usually it's because of one of those things, either because she's hungry, thirsty, or her brief is wet. So check their brief. If their brief is wet, change them, and usually when you change them, they just go right back to sleep, and 5 minutes later, you hear them snoring. They are KO. Anyways, guys, that is it for my nursing hack tips. If you guys have any other nursing hacks that you guys want to share, please leave them down in the comments below. Let's all learn from each other. That's exactly why I created this channel. So if you have any other hacks, leave them down below. And if you like this video, don't forget to give it a thumbs up, like, comment, and subscribe, and turn your notification bell on so you won't miss another video from me again. And I really hope to see you in my next one. Bye.